Do you want us here, talking there? Is that going to work? It's a fresh angle today.
This is like, angle.
Is this like, yeah, it is. Tell me it's Friday.
I'm a bit disorientated.
Okay. Yeah, this is not right, is it?
It's not right.
No.
There's like a ripple through the space-time continuum.
We don't turn to the right.
No, we normally turn to the left. Yes. Perhaps from their view, it's to the left.
Yes. Okay, we're ready to go?
You ready to go? All right. You all ready? Well, thanks very much for coming out today. Today, I'll be introducing into the Senate a fresh piece of legislation to implement Medevac. We've had 2.5 lost years with this government, a government that previously had supported Medevac, a critical legislation that would allow some of the most dreadfully ill people on Nauru and PNG to come to Australia to seek urgent life-saving treatment. International law says Australia is responsible for the welfare of people that they have deported to Nauru and PNG for the perceived crime of seeking asylum and safety in Australia. The Labor Party and the Coalition insist upon their cruel offshore detention regime. And that is something that I think the Australian people will judge them on in this upcoming election. But previously, the now Labor government, when they were in opposition in 2019, supported a move from across the crossbench, actively supported and encouraged a move to introduce legislation to this parliament that allowed for the urgent medical evacuation of people who've sought asylum, who are trapped on Nauru and PNG, to come to Australia to have their life saved. And we're saying to Labor, do that again. Remember that decency that you had in 2019 and join with us to support Medevac legislation. There is a guaranteed progressive majority in this parliament to get this legislation through. There is enormous goodwill in the community to pass legislation that saves people's lives. We can do this. It was done in 2019 and we can do it again. I'll finish by saying, at the end of last year, I travelled to PNG to try and get some understanding of what the situation is for the some 40 people who have been languishing initially in jail-like conditions on Manus Island and for the last 5 or so years in Port Moresby itself. They are in dreadful condition. These were people who came to Australia seeking safety and instead were sent forcibly, returned to PNG. They are having some dreadful mental health conditions, some too ill to leave their room, untreated cancers, and more recently, critical medication such as diabetes medication, heart medication, and medication for their mental health has been withdrawn. They are in the most desperate state. This legislation is more urgently needed now than ever. And again, we say to Labor, you had that position in 2019 when you were in opposition. You've been in government. Don't waste another day. Support this legislation and show the world that Australia does have a heart.
Well, I've been in the federal parliament in the House of Representatives for going on 15 years now. And one of my proudest moments was that day in 2019 when my vote was one of the crucial crossbench votes along with the Labor Party opposition to legislate Medevac. That was a fundamentally good thing that the Parliament did that day. To simply provide for desperately sick asylum seekers to be transported from offshore processing to the Australian mainland for critical medical treatment. So imagine my anticipation that after the 2022 election, that the new Labor federal government, one of the first things it would do would be to restore Medevac. Imagine my shock that I'm standing here now in the closing days, perhaps the second last sitting day for the House of Representatives in this parliament, and the Labor Party has not done anything about restoring Medevac. Now, I'm sorry, but I can only draw one conclusion here, that what the Labor Party did in 2019 was more about scoring points against the LNP government by having them defeated on the floor of the House in a vote, that it was more about that than the inherent importance of providing urgent medical care for desperately sick people. I can only hope that whoever forms the next government, whoever it is, does move to legislate to restore Medevac. And whatever that government looks like, LNP or Labor, I'll certainly be supporting that vote next time around.
Refugees come to this country seeking asylum, and we abandon them offshore in Nauru or in PNG in conditions of abject poverty, and we deny them the basic human rights of medical care. We're asking the Labor government to return to its position of 2019. It feels like being in government in this country leeches political parties of their compassion, their humanity and their generosity. All we're asking the Albanese government to do is to stand by its previous position, that people who come to this country seeking refuge should be treated as humans.
Jana Favero, Deputy CEO at the Asylum Seeker Resource Centre. I'm standing here today, as I did 6 years ago, urging parliamentarians to support Medevac and now restoring Medevac, not as a politician, but as someone who is a human rights activist and advocate, and on behalf of refugees who are stranded on Papua New Guinea and Nauru. 6 years ago, we had this argument because people were in dire medical situations. We saw children who were no longer able to develop properly because of the conditions that they were facing offshore. We saw people withdrawing from life, conditions that were so dire that Medevac was passed. Well, what has changed is that we've added 6 years and there are 39 men and their families who are still in Papua New Guinea and nearly 100 people who are on Nauru. The UN Human Rights Committee report, in a damning report recently, found that Australia has the duty of care. So we very clearly have a duty of care and responsibility who seek asylum on our shores who we abandoned offshore. What this bill seeks to do is actually nothing that's very controversial. We are pleading that people's medical conditions are put in the hands of doctors. It is something that we have a luxury of every day. If my kids get sick, I go to the doctor and they're the ones who recommend what medical treatment is needed. If my mum gets sick, I go to the doctor and we rely on that medical treatment. That is absolutely the only thing that this bill does, is that we are taking the decisions out of politicians' hands, out of bureaucrats' hands and into the hands of doctors about significant health conditions. We recently had a man with dengue fever and pneumonia on PNG who was unable to access any medical treatment. He was turned away from Pacific International Hospital. The only way he was able to get that medical treatment was because of a group of concerned community members in Australia raised $2,000 quickly so he could pay for that treatment. This is what happens when politics poisons policy. It means that people are not able to access the medical care that they require when they are our responsibility. And make no mistake, this is about politics. I know that Dutton will come out and demonise this and try and weaponise it. But last time when Medevac was passed and there were almost 200 people who were medically transferred to Australia, he didn't reject any of those or contest any of those on national security grounds. This is about people, not politics. This is about putting decisions back in doctors' hands to make sure that people get the required medical health that they need, because there is no one who has been trapped offshore who is medically well, and they needed to be medically evacuated to Australia through a process that's driven by doctors to make sure that there are no further deaths. We are really, really fearful that there will be another death at the hands of offshore processing because Australia is turning its back on refugees and not listening to experts and doctors. Thank you.
My name is Zaki Haidari. I'm the strategic campaigner with Amnesty International, but also a former asylum seeker from Afghanistan. Today I'm here because I feel and I trust this is the only tool or bill that will save lives of those that have been warehoused by the Australian government in offshore facilities for over a decade. These are people who ran from persecution, genocide, only to seek asylum in this country. Instead, they were treated really awfully in an offshore facilities in another country. So we strongly believe that it is time for Australia and Australian government to respond to its moral and legal obligation and provide these people the protection that they need. They've been suffering for over 10 years. They're people who run from war conflict areas. It's time for them to receive the care, particularly medical care, that they need and deserve. It's too late now, but still time to save their lives. Thank you.
Are there any questions?
I suppose the first one is why now? If this has been something we've known for 6 years, and of course this government has had progressive majority for 2.5 years, why are we introducing it to these?
Yeah. Well, much of the fight that we've had with Labor has been trying to prevent them making matters worse in this space. Just in the last 24 hours, though, we've had a small little window where Labor has given minor improvements to the rights of people seeking asylum to bring applications in the tribunal. There's a small slither, and it passed with a very strong progressive majority, those amendments in the Senate. But more fundamentally, we've been waiting for the Labor government to act. They're the government, it's their obligation to bring forward legislation, and we've been waiting 2.5 years for this. And if not now, then when? So we say to the Labor government, this may well be the last week. We may come back for a week in March. We would be very happy to facilitate this legislation rapidly through in that week in March. But either way, we need a commitment from Labor, whether it's in government now or it's in the election campaign, that they will get behind and support Medevac, that they will legislate and join with the progressive crossbench to legislate this through in the next parliament. And I think that's a commitment millions of Australians are seeking as well.
Excuse me for a moment. Aren't there medical facilities in those places in Africa already or staff?
Well, I'll speak first to PNG because I was there at the end of last year. The 40 people who have been forcibly deported to PNG from Australia are having their medical treatment withdrawn by the PNG government. When they're approaching the hospital for treatment, they're being refused. When they're approaching the dispensary for medication, they're being refused. They're being refused diabetes treatment, heart treatment. They have significant untreated medical conditions that the system never provided for either. So what we know in PNG is that there's some 39 people who are hanging on to their life by a thread, sometimes only surviving because of donations that are coming from Australia for life-saving medication. That is not a sustainable solution. Lives will be lost if we don't have this. And I might pass to Jana to speak to Nauru.
Yeah, we can speak to that. So we have a detention advocacy casework program where we're speaking directly to people in PNG and Nauru, and they are all reporting issues with not only is there insufficient medical care provided there, but there's also struggles, as Senator Shoebridge has outlined, with accessing that medical care. So, for example, there's no specialised torture and trauma counselling service which is provided on Nauru, and we're talking about people who have been recognised as refugees who are trying to access specialised care and it's just not available. We have a situation where we understand that 2 weeks ago someone was medically evacuated to Australia, which is an admittance that there is not sufficient medical care. We also had the Papua New Guinean government 18 months ago say that they were expecting people to be medically evacuated, admitting that they don't have the requisite medical facilities there. So when you've got the own governments in PNG and Nauru and saying we don't have adequate medical facilities, it shows that this isn't, that there is not appropriate care there, especially not specialised services that are available to people.
All right. Thanks very much, everyone.
We're done? Thank you.
Cheers.
Thank you. Thank
Let's
you.
walk this way.
Yeah.